we're here again. We're back to one of our favorite places in Loudoun County, the Breast Center of Loudoun County. That's funny. So we want to introduce you guys to 4 amazing doctors that we're going to be talking about some very interesting and important topics for women. It's going to be a four-part series,
and we're going to be addressing the most common breast complaints or problems that you may experience.
Yeah.
So we want to address all of your questions, so we'll address them in the video, but if you have any comments or concerns, you can ask them directly to the doctors or comment on the videos.
Yeah, we're going to be putting everyone's information so you guys can directly email them with any concerns that you may have. So it's going to be some very amazing topics, and we cannot wait for you guys to hear about it. So stay tuned. Bye.
Bye.
So good morning. Today we're at the Breast Center of Loudoun, and I have Dr. Nasrullah here, and she's going to talk about nipple discharge. Dr. Nasrullah, do you want to talk about a little bit about yourself?
Thank you. My name is Samina Nasrullah. I am a breast radiologist here at Fairfax Radiology. I finished my training of my fellowship at MD Anderson in 1999. And I started here at Fairfax Radiology in 2002. So I've been doing imaging for 19 years with the group, and we have subspecialized and have developed a very large breast program. And we are excited because we have expanded our services here in Loudoun, and we now have a more broad range of services that we can do here at our new office in the Lansdowne Medical Complex. So what we want to do is help bring information to the community about what breast imaging is.
And we're so excited that you're here.
Great, thank you.
So how common is nipple discharge?
So nipple discharge is usually not related to breast cancer. It is something that 80% of women experience during their reproductive ages. When nipple discharge is coming from both breasts, is white, yellow, or even green, and it is happening when someone is squeezing the nipple, that is usually not something that is worrisome.
So when should I seek imaging for nipple discharge?
So it is when the discharge is happening from one breast, and if you are seeing that it's coming from a certain part of the nipple, like a duct that you can identify or not, if the discharge is bloody, red tinged, clear, and if it's coming out spontaneously, that you're not reproducing this discharge, then I think it would be better to seek out the cause of this. But you know, it's also important that sometimes the discharge doesn't fit a single one criteria, and it's okay to come in to have it evaluated by your doctor and then have imaging to give you a peace of mind.
Okay, no, thank you. That's so good. So what if my doctor recommends imaging for nipple discharge?
So we try to categorize it based on age. If you are under the age of 30 or pregnant, the first study that is required is a breast ultrasound, and that is done usually behind the nipple to see if there's any abnormality. If something is seen on the breast ultrasound, then a mammogram may be required if you're not pregnant, or the ultrasound may be able to give the cause. But if you are over the age of 30 or are non-pregnant, then mammography is the first study to have done, and after that an ultrasound will be done to look at the area behind the nipple to find a cause.
Okay, no, that's so insightful. Thank you. So what will the imaging tell me?
So the imaging may not find any abnormality, or it may find something that is not cancerous, or it may find something that may require a biopsy. If the imaging doesn't find anything, based on your doctor and the radiologist's level of concern, a breast MRI may be required to also better evaluate the area behind the nipple. So remember that nipple discharge is usually not related to breast cancer. And if you're having symptoms, just consult with your doctor to find out what workup is required on the nipple.
Well, thank you for letting us know. I really appreciate your time, and I'm sure all of the ladies of Loudoun County do. If you want to gather more information, you can go to their website, which is posted below, or ask them questions at the email below as well. But thank you so much.
Thank you.
Hi guys, we really hope you enjoyed these amazing videos from these wonderful doctors here at the Breast Center of Loudoun County.
We hope you learned something new about your breasts.
Boobies! Let me be a...
But in all seriousness, if you have any questions, we're going to leave an email address at the bottom here. So if you have any questions or concerns, either contact your primary care physician or we can address them in the comments as well. So until then,
to the next videos with them, we're going to do a lot.
Yeah.
So many more. You have no idea. Like a whole bunch. Every time.
We'll see you soon.
Bye!
Bye.